just this awful pain right in my stomach. Feels like someone's twisting me up inside. It's been going on for a few days now, and honestly, it's the worst pain I've ever had.
That sounds really bad for you, Jane. I'd like to get you some painkillers in a minute, but it's just wanting to know a few more things on the last, perhaps, few days, if that's okay.
Yeah, fine. Ask away.
Being inside someone else's doctor's appointment feels a bit intrusive. Except Jane, who you were hearing from there, isn't actually real.
You're looking at a whole database, or even a hospital, of artificial patients. We've got a problem coming with the NHS, and that is workforce training. We need more healthcare professionals, doctors, nurses, but we've got a bottleneck in training. There's not enough clinicians to train all the new trainees, so we need to look at technology for solutions. And one of these technologies that I'm sure everyone's heard is artificial intelligence. So these are synthetic patients. They're not real, but they have their own brains. But it's almost thinking about it like they have reasoning. It has lots of layers to it where we're creating real emotions, real patients that doctors, nurses, students can all train with in a safe fashion as many times as they need to become more competent. And what we really want is competent communication in the NHS. It has a large cost, not just to patients' health, certainly. It costs up to £1 billion a year in communication errors. And if we can create more competent communicators, we'll hopefully have happier patients and happier doctors.
Just hear about the blood tests, I reckon. Things are a bit up and down with my sugars, that's all.
Oh, okay. Tell me more about your sugar control, David, your diabetes. What's been happening?
Well, like I said, the numbers are going up, I think. I've been trying to watch what I eat, but with my shifts and all, it's not easy to keep a proper routine.
Before things like this, how were, for example, trainee GPs learning to deal with patients?
You've got the in practice with the real patients, but that's not always convenient. You might want to be learning about, for example, diabetes, but you might not see a diabetic patient that morning. So then they'll be learning what's called peer-to-peer learning, so other doctors pretend to be the patient. And that's not perfect in any way, and we can improve on that now with technology, and particularly with SimFlow.ai.
Chris says he's had students at the universities of Bristol and Bath try it out too, as well as his pupils at the Great Western Hospital, with good feedback. It would be an extra on top of other training rather than a replacement. So what are the common mistakes made that this could help with?
There's often the speed at which we can consult at, and AI has shown that we can be more empathic using AI. So there's the rapport building, there's sometimes the lack of detail we get from a patient, which creates the misdiagnosis. And this is the cost to the NHS, really, as well as the patients. I think we need to continue innovating. We need to try and introduce this into healthcare, but also take a stance where we're looking at the results. We take an evidence-based approach to this. It isn't just, here's the technology and off you go. Here's the technology, does it work? And that's what we're trying to answer at Great Western Hospital.